Hey guys, I'm Dr. Chris Skelton over at SOSF CrossFit and Chiropractic, continuing on the Freedom Through Function movement. So we're looking to free ourselves of injury, compensation, and any disease through functional exercise and corrective exercise. So I'm here with Dan and JT, and we're going to look at the hip flexor today. So a lot of people come in maybe with a little bit of low back pain, where they're tight and they're feeling their low back, and a lot of this might not be because of the low back, but it might be because of some tight hip flexors. So in order to check if you do have the tight hip flexor, we're going to put these two guys in a modified Thomas test. It's an orthopedic move to see if we do have any of this tightness in the hip flexor. Okay, so Dan's going to go back. Okay, and as he drops his leg, you see he has this high angle right here at the knee. The knee should be at about 90 degrees here, but when we let his knee go, you see it tightens back up. Okay, so that's a tight, thin muscle right here called the rectus femoris. It is involved in hip flexion. So when we see this tightness, we're going to have him get up for treatment, and we're going to shift him off to the side so that his thigh is a little more supportive. And we're just going to get his leg down to about 90 degrees here. He's going to pull this leg in nice and tight and hold here. Okay, if he starts to feel a burning or anything right here, we want to let go immediately. This is a really thin muscle, so it can get injured. Now with JT, we look here, and now you see his knee angle is okay, but the hip angle is not. The thigh should be parallel to the ground. So with that, we have a very tight psoas muscle. That's the big, big hip flexor muscle. So we could put a sandbag here, or have him hold a medicine ball here, something not too heavy, so we can drive that hip flexor down to about parallel. Okay, so we want to hold these on each side. Always do both sides. We want to hold these for about 2 to 3 minutes per side, and then see if the back pain alleviates. All right, guys, thanks. We'll see you next week.